this video, you will learn about various complications of a vasectomy. No-snip vasectomy is a minimally invasive procedure and has a much lesser risk of complications compared to the regular vasectomy that is performed with an incision. These infrequent complications include bleeding, which is minimal with our no-snip technique. We recommend that you take it easy for the first 24 to 48 hours to reduce the risk of bleeding. The infection rate after a vasectomy is low. Although not absolutely necessary, we recommend a few doses of prophylactic antibiotics to prevent infection. Pain after the vasectomy is like any other cut in the body after the anesthetic wears off. Most of the pain or discomfort at the site of vasectomy is due to the weight and the movement of the testes. This can be managed with tight underwear or scrotal support. Most vasectomy pains heal in about 5 to 7 days. There is, however, a small group of patients that can develop pain after the vasectomy is supposed to have healed. This is called post-vasectomy pain syndrome. This can happen in the early post-operative period, or more typically, many months after a vasectomy. We use the term syndrome when we cannot attribute a definitive cause to a symptom complex. The cause of chronic scrotal pain after vasectomy is poorly understood, but may be related to infection, epididymal or vas congestion, back pressure-induced epididymal rupture, sperm granuloma formation, or nerve entrapment. Luckily, the incidence of post-vasectomy pain syndrome is low at 1 to 2%. It is, however, important to know that the condition exists, and additional treatments may be necessary to relieve the pain syndrome if this does develop. These treatments may be medical and rarely surgical. Anti-sperm antibodies may be formed after vasectomy. They do not cause any harm. They can, however, become an important factor if you ever decide to have the vasectomy reversed to have another child. In that case, they may attack the sperm. One must also know that vasectomy reversal is an expensive procedure, and most insurances typically do not cover it. There are debates about whether vasectomy causes various illnesses. One of the predominant debates has been whether vasectomy causes prostate cancer. We do not believe that vasectomy is a cause of prostate cancer because the studies have shown that the incidence of prostate cancer in men who had vasectomy compared to those who did not have a vasectomy is similar.